Hello, bienvenidos. Ayimi Hamuskahichik. Welcome to the 2018 slideshow for the Idaho Condor Peruvian Expedition. This presentation includes a summary of clinical data and photographs collected during the expedition. The Board of Idaho Condor Humanitarian Services hopes you find it both enjoyable and informative. Over 60 volunteers from Idaho, Utah, Montana, Washington, California, and Peru visited 5 villages including Catka, Kikihana, Huanoquite, Ancahuasi, and Ocopata, providing medical, dental, audiology, and pharmacy services. New for 2018 was the Days for Girls program. We estimated over 3,300 individual patient encounters were provided. Idaho Condor Humanitarian is a national nonprofit dedicated to providing cost-free medical care to the indigent of Peru. Our organization is built on the idea that a collective of caring people can effect positive changes on individuals, communities, and nations. Based out of Cusco in the heart of the Andes, we travel by bus each day to an outlying community. In odd-number years, surgical services are provided cost-free from the hospital in Cusco. In 2018, the expedition included the Days for Girls program, an international organization providing dignity, health, and opportunity through education and menstrual health solutions. A key feature of the Idaho Condor expedition is providing free medication, when appropriate, to patients who attend our clinics. Most medications are purchased prior to the trip, with some resupply in-country. Now in its 3rd year, our audiology team saw 205 patients, finding 62 occlusions, 6 perforations, 6 infections including 5 otitis media and 1 fungal otitis externa, and 1 case of microtia. 74 patients received audiogram testing to assess for significant hearing loss. 24 hearing devices were fitted for patients who met stringent criteria: a pure tone average of 40 decibel hearing loss or worse in the better ear, age less than 80, showing appropriate dexterity and vision to manipulate the device, and family support, which means living with a family member or has daily visits to make sure equipment is functioning. Our dental team saw 1,024 patients. In addition to fluoride application, several hundred procedures were performed, including 347 extractions, 364 fillings, and 41 prophylactic or debridement procedures. Our providers work in concert with Peruvian providers to bring a level of basic dental care to the indigent of Peru. The 2018 medical team documented 1,030 patient encounters. 2 family practice physicians, 2 physician assistants, 1 CRNA, and 1 pediatrician worked alongside 3 Peruvian providers in delivering this care. This year was the first concerted effort at data collection of patient encounters. The information was hand-collected and hand-compiled. We had a 94% success rate in capture of age, gender, language, chief complaint, and diagnosis. This shows the dedication and hard work of all our volunteers. Among the 1,030 patients documented, we recorded 1,381 chief complaints and 1,549 diagnoses. Patients were in approximately a 2-to-1 female-to-male ratio. Over 2/3 of the patients were between the ages of 30 and 69. There was approximately a 2-to-1 Spanish to Quechua ratio but this turned out to be a very age-dependent phenomenon. Language usage showed a marked generational pattern. Under the age of 40, 80% of patient interviews were conducted in the Spanish language. However, over the age of 60, 75% of patient interviews were conducted via a Spanish interpreter into Quechua and back. The expedition sees patients across the life cycle, from the very old to the very young. The 5 most common chief complaints comprised 80% of total, representing musculoskeletal, abdominal, headache, eye, and urinary complaints. Multiple complaints were common, 1,381 recorded among 1,030 patients. Some double counting of chief complaint was employed to represent the breadth of different complaints. And there was a clear connection to lifestyle, the hygiene and nutrition associated with poverty, and their lives spent in manual labor. 1,539 different diagnoses were made for this year's patient population. Decisions of clumping versus splitting diagnoses for analysis were made retrospectively to collection. Some diagnoses were counted twice. For instance, cellulitis may be a skin or an infectious diagnosis. Gastritis could be included in the GI or nutrition or infectious category. And fungal infections could be related to OB/GYN, skin, or ear, nose, and throat. Future expeditions would benefit from more topical agents such as eye drops and analgesic creams, ointments, and gels. Gifts for those who provide local assistance such as interpreters and in-country liaisons. A vision component featuring optometry, screening, or eyeglasses. Providing basic ultrasound or X-ray services. And a wish for help from dermatology, rheumatology, and plastic surgery. The lifeblood of the Idaho Condor expedition is people. Volunteers like you. People with a willing heart to serve. That's it. That's all we need. Skills are helpful. Spanish fluency for triage or patient encounters. Any kind of healthcare experience, medical, surgical, dental, pharmacy, audiology, vision, radiology. If you're willing to help, we're willing to have you along. Come join us in Cusco.